Welcome. We know you put a lot of time and effort into caring for the patients who come through your doors, especially those with 2 or more chronic conditions. Managing a full patient load while trying to execute a successful chronic care management program can be extremely challenging. You want to provide patients with that extra level of care and support, but how do you find the time for it? We understand you're busy, and we're here to help. Your organization has contracted with H3C for a chronic care management program for your practice and your eligible Medicare patients. This program is designed to complement your patient care between office visits with monthly phone calls following clinical pathways and utilizing evidence-based risk assessments. Groups that have successfully implemented CCM programs call it the backbone of value-based care. So let's explore how the program works, what you can expect, the benefits to you and your patients, and how you can help us succeed together. But first, a little bit about H3C. H3C is a chronic care management company headquartered and operated in Omaha, Nebraska. We operate with a firm belief: frequent communication is critical in order to have a successful chronic care management program. Our clinical call center is staffed with licensed healthcare professionals of all levels, specializing in chronic care management. We will work with your champion to ensure that frequent communication between us, your patients, and you is seamless. You will receive a number of communications from H3C regarding your patients. This includes encounter notes, care plans, and monthly risk reports. Let's start with a look at the encounter notes. They will look something like this. At the end of each encounter, our staff will upload our comprehensive, concise, and evidence-based documentation directly into your patient's chart. These notes are either attached as a PDF or are cut and pasted directly into the EMR in real time. That's right, you don't need to learn a third-party portal to retrieve this information. As you can see, the information in the encounter note is color-coded for ease of use. Red indicates areas of high risk, yellow is moderate risk, and green is low risk. Providers appreciate the ability to hit the highlights when reviewing this type of documentation. In the 2nd or 3rd month of a patient's participation, we create a care plan based upon the risk assessments we mentioned earlier. Like the encounter notes, they are also color-coded and posted in real time into the patient's record. These plans are tailored to the specific conditions of the patient and address their problem-specific needs. They are updated from 1 month to the next as the patient's situation changes. Additionally, a change in the patient's condition can automatically trigger an accelerated care plan review by H3C's RN before being escalated to the patient's provider. Our problem-specific clinical pathways are goal-driven. They trigger interventions and can help patients overcome barriers and achieve their health goals, which often leads to better outcomes. Now, let's take a look at end-of-month reporting. Each month, a risk report will be available for your enrolled patient population. Again, the risk levels are color-coded: red for high, yellow for moderate, green for low. The number of high-risk problems the patient has is indicated by the numeral to the left of the decimal point. The number for moderate risk is to the right. For example, this report indicates that Phoebe Levine is at highest overall risk with 4 high-risk and 5 moderate-risk problems. This report can also be resorted by changes in patient's condition or sorted by specific assessment areas to identify opportunities for programs that may benefit multiple patients. We capture the raw scores for each assessment and also normalize these scores on a 10-point scale. If needed, you can review the raw and converted score reports for all of the assessments that we conduct. These are sent to your champion periodically. Overall, these reports provide a nice overview of your current population and assist providers, nurses, and case managers as they risk stratify the enrolled population. Providers love using this snapshot to guide them to where their efforts may have the greatest impact. So, how do we begin? Right now, we're in the process of determining the list of eligible patients from your organization. We will identify Medicare patients with 2 or more chronic conditions with whom you had an office visit in the past 12 months. Then, we'll send them a postcard, introducing them to the program. Everything is designed to come from your organization, right down to the inbound caller ID number. We simply serve as an extension of your practice. For patients who opt in, we will gain their consent, send you the list of those who have enrolled, and begin the process of conducting risk assessments and creating care plans as we mentioned earlier. Because this is an optional program, there may be a copay in some cases. This is clearly indicated in both the introductory postcard as well as in our follow-up call to the patient. Patients may choose to unenroll at any time, but they usually find value in sticking with the program, even if it's just to speak with our care coordinators on a monthly basis. Our program is designed to help support and risk stratify your efforts, which leads to improved quality measures, better patient engagement, higher rates of medication compliance, fewer trips to the ER, and overall higher patient satisfaction. Now, we know what you're thinking. What do I have to do? The answer: very little. This program is designed to complement, not replace, the efforts of you and your staff. In short, you can help by advocating and supporting the program when in contact with your patients, ensuring that your front office staff is aware and informed. A set of frequently asked questions will be provided to all clinic support staff to ease the transition. You can also provide us with periodic feedback through your organization's champion or directly to us. And last, but certainly not least, thank you very much for supporting this effort. We're excited to be a part of your care team.